Okay, thank you. Good afternoon. So I think that I will continue the subject of media campaign, and my presentation will be divided into two parts. First will concern about the conditions, minimum conditions, which should be fulfilled if we want to increase the effectiveness of media campaign. And the second part of my presentation will concern a media campaign which was conducted in Central Asia, in Tajikistan, in the framework of a program named Central Asia Drug Action Program Phase 5. So I will give you all those information. But first of all, I would like to say that I am not researcher, I am not scientist. I am a person who works in the Ministry of Health, and I took responsibility for the drug policy. So I would like to give you some information how to prepare an effective media campaign from this perspective, taking into account the research, the findings from many research which were conducted by distinguished researchers in this field. Many difficulties about the media campaign were mentioned by my colleague Richard Ives. That it's very, very difficult to prepare good media campaign. However, we know that media campaigns still are a very popular tool in the preventive activity. So why those media campaigns are so popular? I think that there are a few reasons. Of course, probably much more than I listed, but of course we can reach large population at a relatively low cost per capita. Also, using media campaign, we can create favorable climate for discussion on health issues, and also to promote or to build some positive climate concerning, for instance, new legislation, which will support some efforts to improve our health. But also, media campaign may counterbalance to permissive message to use psychoactive substances created by mass media, celebrities, music production, at least in Europe. And of course, media campaign can have direct and indirect impact on target audience. It means that even those people who have never met the message from media can be influenced by the media campaign if they belong to a certain social network of people who decided, for instance, to quit smoking or something like that. So, I'm not sure whether it is. Yes. So what kind of recommendations we can make? Firstly, majority of campaigns which were in some extent at least effective draw on evidence-based theories, and behind the majority of good media campaigns, effective media campaigns, it is mentioned two theories. First, it is social learning theory, which explains not only how we acquire behavior, but also show how we can change our behavior, and health belief model, which assume that health beliefs heavily influence health behavior practice. So everything depends whether we perceive that our health is important, is valuable for us or not, or whether the consequences connected with taking some actions will be very serious and harmful for us or not. All those information are very important. If we want to prepare effective media campaign, we should very carefully collect all those information in the context of target population, target audience to which we direct our media campaign. It was mentioned by Richard Ives about how to build message of campaigns, scared or not. In majority of studies, it seems that we shouldn't scare, but show rather effective solution. Also, we shouldn't refer to the risk which can happen in the distant future, for instance, lung cancer, if we direct our media campaign to young people. So it is very, very long, distant consequence which can appear. We should refer to the consequences which are present in the experience of a target audience. So rather, we should use such example that smoking cigarettes can lead to problem in school with parents, but not use the examples which are not in the field of experience target audience. But it is also, I think, worth mentioning that there are some findings that inform us that this issue of scar or not might be dependent on socioeconomic status, and that in some countries with lower socioeconomic status, maybe this kind of scared, fear-based appeals also worked. This issue needs to be explored by scientists further. Persuasive message of campaign. So again, there were a lot of studies in this field, and it seems that good message should raise the question in the mind of a receiver, also provide an answer to these questions, and the message should be prepared in this way to make counter-argument difficult or necessary, and also we should put a lot of efforts to ensure that message source is viewed as expert. For instance, those companies which are supported by alcohol industry can provoke some kind of ambiguous perception of this campaign, because this message is not built on the expert base, but by alcohol industry, which is involved in promotion also alcohol. Drinking alcohol. We should avoid what Richard said, showing drug use, accessories to use drugs, arguments which are contradict to the experience, for instance, that using marijuana is equal death, because in many countries, for instance in Poland, about 30% young people had at least one experience with using marijuana, and they see that it is not true. So we should avoid this kind of communication. And also it seems that young people are resistant to the manipulative information, to the manipulative message, like for instance using drugs, you sponsor terrorism or organized crime. If it's possible, it is recommended to apply social marketing principles. Firstly, because using this kind of approach, we can identify and define in a very precise way our target audience, their need, their motives. Richard mentioned about it also. One of the main tools in the social marketing principle is free or low price distribution of campaign products. For instance, bicycle helmets in the campaign devoted to road accident, or replacement therapy in the media campaign addressed to quit smoking. Also, it is interesting because from many studies and research, it turned out that effective campaigns lasted at least 3 consecutive years. TV spots were released approximately 200 times each year, and radio spots about 300 times for at least 4 weeks. And of course, TV radio spots broadcasted at the right time for the target audience. We should avoid seeing separate actions. From one side, all those recommendations seems to be very obvious. However, from the other hand, we know that there are a lot of media campaigns which last only 1 week or 1 day and are connected with International Days Against Drugs. This kind of approach for sure doesn't work. And This slide is very important, that if we want to increase the effectiveness of media campaign, we should use multi-channels information and intervention. So firstly, we should base our media campaign on local community actions and school-based programs. There are a lot of studies which confirm these findings, which we should teach youth new skills, for instance, refusal or coping with stress, and strengthen the parental skills. And also what is important about adolescents, that if you want to change adolescent behavior, it is much more effective to direct and address media campaign to parents. If we influence parents, it is more probably that also behavior of young people, youth, it's more possible to be changed. The next part of my presentation concerns media campaign in Dushanbe in Tajikistan. This media campaign was conducted in 2012. It was very, very interesting experience. As you see in this media campaign, a lot of people from Dushanbe were involved. And this media campaign was conducted in this framework of this CADAP program. The goal was to encourage parents to spend more time with their children and better monitor their leisure time. We conducted qualitative research before campaign to collect information about target audience. Also, pilot study was conducted. A lot of channels of information was used in this media campaign: TV, radio spot broadcasted by a few TV radio channels. TV and radio spots were broadcasted almost through 4 months, and a few times per day. Also, hotline and consulting center was created in this time when media campaign was conducted. Of course, brochures, special family picnic were organized. It was very important element in the Tajikistan that female religious leaders were involved in the process. Those women were very, very active. They were trained, and then they had a special meeting with parents and also discussed about the issue of upbringing youth and different problems which can be met in the process of upbringing. And the crucial point was parental meeting in the school at class level. The special scenario was prepared by experts. This scenario was checked whether worked in the Tajik situation, in the Tajik settings. So also special pilot study was conducted. And teachers were trained how to use this scenario. It means that teachers received some kind of ready tool how to teach parents some kind of parental important skills which should be useful for them. And also some kinds of theater performance was prepared by young people. It is important that this campaign was evaluated. So was pre-test and post-test. We have intervention group and control group. And also this campaign was evaluated using qualitative and quantitative methods. 5 focus groups were conducted: parents, teachers, and heads. Also, we had focus group with representatives of media, governmental institutions, religion organization, and individual in-depth interviews were conducted. And the results of school-based actions, because it is also important that this pre-test, post-test was conducted on the school level. So of course, we ask about the availability and perception of media campaign. It means those channels of information in which way the information about media campaign were received by our target audience, but this evaluation and the results which I will comment mainly concern about this activity which was conducted at the school level. So the survey among parents and students was conducted twice before the campaign implementation and after. Schools and classes were selected randomly, and the sample consisted of two groups. One was the classes where parental meetings were implemented, and the classes where these activities were not implemented. And what are the results? I only took one of the variables which we consider and assessed. So we, for instance, asked about whether a child talked to parents about his or her problems. And you see how the percent of answers look. Parents intervention group and parents control group, pre-test and post-test, and also the same question was addressed to students in intervention group and control group. And we see that really serious change in this aspect was observed after the intervention conducted at the school level. So those parents who took part in this special meeting which was addressed to them, conducted by teachers, and refers to the issue of upbringing young people, to the issue of using psychoactive substances, during which parents were encouraged to monitor better their children. It turned out that there are very visible results. Of course, there are a lot of restrictions because we conducted this study before, pre-test, post-test, but anyway, we didn't continue any kind of checkups. So we didn't check whether this kind of changes was sustainable after, for instance, 6 months. Anyway, I think that this kind of study is also very valuable. And the effect of the campaign was more visible among parents, a little bit weaker among students. Parents from the intervention group improved their relationship with their children more than parents from the control group, and direct communication with parents during parental meeting was the most effective way to influence parents' attitudes and behavior. Evaluation proved that prevention based on positive message instead of scaring is applicable in Tajik reality. This campaign in Tajikistan was quite innovative in Tajik settings. It means that it was first campaign which was based on positive message, which didn't refer to fear-based appeals, and also it was first campaign which was conducted for so big scale and which integrates school, parents, media. So it was very, very interesting experience and also very valuable experience for our Tajik colleagues. Thank you for your attention.